speaker is Dr. Varsha. Is she here? Yeah.
A very good morning to all. I'll be talking about our paper on post-operative visual loss following orbital surgeries, a 24-year experience at a tertiary eye care center. Vision loss following orbital surgery is the single most dreaded complication of any surgeon or a patient, and it has significant medical legal implications as well as psychological and socio-economical implications. Our objective was to study the risk factors, clinical, radiological, pathological profile, and management outcomes in postoperative visual loss following orbital surgeries at a tertiary eye care center. It is a retrospective interventional case series. Patients with postoperative visual loss following orbital surgery over a period of 20 years from 2000 to 2024 were included in the study. The outcome measures were demographic data, clinical presentations, radiological features, pathological profile, causes, and the visual outcomes. A total of 22 cases were included in the study. The mean age was 43 years. The majority of the cases were following a tumor removal surgery, which amounts to 63% of the cases. This was followed by fracture repair with 14%. Coming to the incidence of POVL, following tumor removal surgery, the incidence of postoperative visual loss was 1.77%, whereas following orbital decompression and fracture repair was 1.06 and 0.56%. All the tumors were located in the intraconal space, and the most common location was the temporal to the optic nerve. 6 cases of intraconal tumors were located temporal to the optic nerve, which had POVL. Histopathology proved that majority of the cases, almost up to 50%, were schwannomas. This was followed by cavernous hemangioma, which was noted in 14% of the cases, 22% of the cases. The causes of the POVL was also assessed. 64% of the cases had central retinal artery occlusion, and 23%, 5 in number, was attributed to compressive optic neuropathy. Ophthalmic artery occlusion, ischemic optic neuropathy, and direct injury to the optic nerve was seen in one patient each. The preoperative vision was normal, 6.6 in 63.6% of the patients, whereas the rest had a preoperative drop in vision. Immediate post-op vision on the same day, about 2 to 3 hours after the surgery, was noted, and no PL was noted in 15 cases, which amounts to 68.2% of the cases, and the drop in vision ranged from no PL and to 2/60. The treatment which was given was IVMP 1 gram 3 doses immediately after the surgery on the first post-op day, as well as followed by the next 2 days, and oral steroids. One patient had undergone an implant removal as the compressive optic neuropathy was attributed to the implant position. 59.1% of cases remained no PL, and these were all CRAOs, whereas 5 cases luckily had improvement in vision, which amounted to 22.7%. Surprisingly, 2 of them were no PL postoperatively, and both had improved to 6.6 vision with grossly restricted field effect with a small temporal island of vision. In comparison to the other studies, the POL incidence after tumor removal in our case series is 1.77%, which is comparatively lesser than other studies. The incidence followed by the fracture repair was, however, slightly higher compared to some of them. So our study, the POVL was seen maximum after the tumor removal surgery, which was inconsistent with other studies by Dr. Rose et al. Permanent blindness again was noted in 59.7% of our cases, and this was inconsistent with the other findings of the study, other studies. partial recovery was noted in 22.7% of cases with prompt treatment. In conclusion, intracorneal lesions located temporal to the optic nerve pose a higher risk for POVL. Retinal artery occlusion is the most common cause of visual loss. Close monitoring and urgent management may improve visual outcome. Patients with compressive optic neuropathy fare better after prompt treatment. These are my references. Thank you.
Thank you, Dr. It's a good study. Uh, how many cases were the intraconal, rather near the optic nerve or surrounding the optic nerve?
All the
Who are
cases were
having, total number of cases, and
Yes.
out of whom how many cases you told 22.
22 cases with a total number of cases. So tumor removal was in 14 cases, sir.
So all 14.
All 14 were intracorneal lesions. They were excisional biopsies.
So all they have the visual loss.
Yes, these 14 cases were all intracorneal lesions. So the total number of cases over the period of 24 years was 790 patients, total number.
Then one more finding you told that some two cases were having
Yes.
no PL
Yes,
before,
yes.
and after that they removed.
Yes, surprisingly.
So what was the reason?
So the one case was a fracture repair patient where the implant was positioned. This was a post FES done patient elsewhere, wherein the debridement of orbital tissue was inadvertently done with the debrider possibly. So there was no intracorneal fat surrounding the optic nerve in the quadrant. So when we had placed the mesh, immediately in the ICU when we had assessed the vision, it was no PLs. We had removed the implant and again administered IVMP in the vision required. The other patient was again a fracture repair which was done endoscopically. Wherein there was no reason for compressive optic neuropathy, so ischemic optic neuropathy was the possible diagnosis. This particular child had even developed an XT, for which, because of the severe drop in vision, and then because he had regained a little bit of island of vision, surprisingly, the squint correction was also done, and he had a gross field effect, but still he has 6/6 vision. So these were the two cases which we were quite surprised that though the patient has no PL, amazingly they recovered, and the one patient was actually a medical
I think
rep.
they
So
must
it
have
was
done
extremely stressful.
very quickly. Surgery must have been done very quickly after.
Yes, the implant removal had done the same day. It was actually one of my
Thank you.
patients had
Thank
done
you.
it the
Thank you
same
so
day.
much.
Thank you.
Just one more thing. It seems all the intracorneal tumor had lost vision.
No, ma'am. The total number of cases included in the study was 790 patients, and in that, 14 patients had lost vision. So our incidence is actually 1.77%.
Of vision loss.
Yeah,
And
yes.
how you explain in central retinal artery occlusion?
Central retinal artery occlusion or ophthalmic artery occlusion was quite a clear-cut diagnosis clinically. Fundus photograph and FFA was also done. So differentiation between CRAO and ophthalmic artery occlusion was done with the help of FFA.
No, etiology.
Etiology was a clinical diagnosis when they had cherry red spot and pale retina on examination for the CRAO part of it. But for the compressive optic neuropathy is more of an attribution. We cannot really distinguish ischemic and compressive optic neuropathy with only clinical and investigations. Possible diagnosis, ma'am.
Okay. Thank you.
Thank you.